so many people with back pain, but generally what causes back pain? I mean, there's a huge amount of the population suffer.
That's right. So 4 out of 5 of us at some point will get back pain, and actually right now in England over 5 million people have got severe long-term back pain. Often it's a combination of how we use our backs, so the muscles around the back which are there to strengthen and stabilise the back, and if those muscles aren't strong and if the back isn't supple, then the muscles can spasm and really hurt.
A lot of us are sedentary. You say you've got to keep on the move. Rest is not best.
Rest is the worst thing you can do. If you wake up with back pain or you've got back pain, if you rest, you rust. You've got to keep moving and take the painkillers so you can keep moving. Don't stinge on painkillers and rest.
So don't think I need to lie down. We've got a very young, fit Sam, our runner Sam here. I'm sure hasn't got back pain, but we thought we'd use him for you to show us a couple of stretches.
It'll come, Sam, it'll come.
So, Sam, I'm going to ask you to lie down, and what we're showing everybody here at home is some exercises that any of us can do if you're worried about getting back pain or if you've got some back pain and you want to treat it. So the first thing is, Sam, I want you just to lift your knee, do it on your right knee, and just put your hands around your knee, and then with your back flat, and then pull that in towards your shoulder, hold that and you'll feel a stretch, and then let that go, and you can repeat that on the other side. And you do those a few times, do those twice a day. The other exercise you can do then, if you just, is just bring both your knees up, keeping your feet on the floor, and what I want you to do is, with your knees together, I want you to rotate your knees one side onto the floor. That's right.
I do this one.
That's a good one.
It's a really good one.
Stretches your...
It's stretching all the muscles
pelvis.
in the lower back,
Yes.
and exactly around there, and then the other way as well, and hold that. So there's lots more stretching exercises. Also, you need to add some strengthening exercises. Thanks, Sam, you're done. But add some strengthening exercises as well. If people are looking, there's lots of advice online, and Arthritis Research UK website, you can find ideas for strengthening and stretching exercises.
Well, Cassie, first of all, on the phones, you think that childbirth may have resulted in your back pain?
Hi, I had a emergency cesarean 9 weeks ago, and I've been getting this terrible back pain in the middle of my back when my son was 2 weeks old. It tends to just stay in the middle, but sometimes at the end of the day it can stretch down to my lower back.
So
I'm struggling to pick my little boy up.
Oh gosh,
that's really
hard.
awful. So you've been, you've got this double whammy there.
You've
had an operation which has weakened all the muscles, and it's put you, so you're moving differently, and you're in pain, and you're having to lift a new child, so you're in pain from that. And what should be a really lovely and happy time, actually, you've got all this pain. Cassie, has anybody talked to you about exercises? Is that something that you've tried?
No, they haven't.
So I think that's a really good place to start. Some simple stretches. You've just had an operation, so be gentle at first, but start with the stretches, add some gentle stretching exercises, and when you can find time to get away, maybe doing some exercise out of the home as well. But I think adding in some strengthening and stretching exercises, and I think this is going to get better for you. And if it doesn't, like any other back pain that doesn't get better, make sure you see your doctor.
Oh, good luck, Cassie. It's always, a lot of women suffer back pain, don't they, after childbirth? You've got to strengthen your core again, as well.
Absolutely.
Let's talk to Catherine. Hello, Catherine.
Good morning.
Good morning. Now, you look after your son, who suffers from seizures, so you have to carry him.
Syndrome.
OK, I'm sorry to hear that, but you have to carry him a lot.
Yes.
So how is that affecting your back?
My back is awful. I suffer from sciatica because of it, and I get pain, especially my lower back, but it feels like a pressure. The only way I can describe it is it's as if someone has jabbed a screwdriver into the bottom of my spine.
Ow. Wow. That's horrible.
That sounds incredibly painful. So sciatica, this is pain coming down the legs. Sometimes people get numbness or tingling as well. And it's caused when something is pressing on a nerve. It can be a disc bulging and it's pressing on a nerve. Most sciatica gets better on its own with time and with exercise, and there's medication that can help as well.
You've had some physiotherapy, I think, Catherine, haven't you?
Yes.
And did that help at all?
No, they've given me exercises to do that I do 4 times a day, but I just don't get any relief.
I mean, Catherine, it sounds that you're saying you have to lift your son a lot when he has a seizure or collapses, and that he's unsteadied, so you're having to support a lot of his weight. And I wonder if that's putting a lot of pressure. So we've talked about strengthening and stretching, that's important, but we need to protect our backs from lifting things that are too heavy or awkward. And you're having to do that. I mean, how many times a day are you having to pick up and carry your son?
Countless times. He has an ataxic gait, so he is very, very wobbly.
OK.
Could she wear a back brace or something?
So I don't know if the answer here is a back brace. I think strengthening the muscles, and you're doing that. But I think it sounds like for me that you need to get some help with actually the lifting. So whether there's some equipment that you can use to help you if you're having to carry him up the stairs a lot.
Go and see a professional as well.
Yeah, get
Canon,
some
we're
help
out of
with that.
time on this. Thank you very much indeed for that, Dr. Ben.